Have you had any issues with recruiters trying to keep you in your own lane in clinical research? That's what we're going to talk about today. Stay tuned. Hey guys, ECRG here, back with another video. Now I know you guys have noticed that the clinical research industry is picking up, as I have said for a while now in 2018, but recruiters are probably reaching out to you and trying to keep you in your own lane. Now this is for people with clinical research experience I'm talking about here. So recruiters may contact you if you're a in-house CRA. They may say, you know what, I've got a position over here for another in-house CRA. Are you interested? Or hey, you're a clinical trial assistant. I got a position for you, another clinical trial assistant. Are you interested? And now a lot of people are looking to move. If you're in clinical, a lot of people want to move over to a different side of the business. Maybe they want to move over to project management. Or, maybe you're an in-house CRA and you want to make the jump to a field CRA. But recruiters are just hitting you up about in-house CRA positions. And I know this was incredibly frustrating for me. Recruiters just wanting to keep you in your own lane. But there's a way around this. And that's what we're going to talk about right now. So what do you do? I mean, we've done a video on this before. What do you do when recruiters call you for jobs that you don't want? This is kind of in that similar type of situation where recruiters are calling you for jobs that you may want. Maybe some people want another job elsewhere doing the same thing because you may get more money, you may get that promotion, et cetera, et cetera. Whatever the reasons are, you hate your manager, whatever the reasons are to make that jump to a different company are. But a lot of people want to change roles when they move to a different company. But it sucks because recruiters, when they reach out, just try and look at your past experience and say, okay, this person is a project manager, so let's offer them another project manager position. But what if they want to be a project director? So here's what you can do to kind of offset that and balance that. Is one of the things that I do is I talk to every recruiter on the phone regardless of position that they're recruiting for. So they may even be contacting me for a position that's beneath me, but I talk to them. And that's because recruiters are not just working on one type of role at a time. And that's not the only kind of role they're gonna be working on for their career. So I talk to every recruiter because, hey, they may be a clinical trial assistant position this week. Next week, it could be a project manager position. So I make sure I take some moments out of my day to really build that rapport with them, because you never know when they could be calling you back for that position you want. So always take that call. That's step number one. But when they ask you, what your goals are, be honest with them. You've got to be honest with the recruiters because their mission is not always going to be well aligned with your mission. Their mission is to give the client that they're recruiting for the candidate that can do the job the best. Recruiters are not always interested in giving you the job that corresponds with your career goals. So you've got to be mindful of that. It's all up to you to make sure that you are doing what's best for you, your career goals. A lot of times these salaries that they offer you and the sign-on bonuses are very attractive, and it can be hard to turn them down. But you, at the end of the day, are going to be the person in that job, not the recruiter or the hiring manager. It is you that's going to have to do those tasks on a day in and day out basis. And you want to make sure that you're as happy, for the time being, for the next year, 2 years, 3 years, 4 years, that you're going to be happy doing that job. So do not let a recruiter talk to you into taking a job, even interviewing for the job if you have no interest in doing the job. Recruiters can be very good at selling these positions because, hey, they want that position to be filled so they can move on to the next thing. They are not always in line with how you want to be, how you want the fit to be with your next job and your next career move. And I see this all the time. Especially after you get some clinical research experience, recruiters are going to be hitting you up. And you want to make sure that you are making the best decision for you when that happens. So you got to be honest with yourself, and you want to make sure that you do your best to put your best foot forward and do what you got to do to make sure that you are in line with your career goals. And a lot of things that recruiters will also do is say, okay, let's say you're an in-house CRA and you want to be a field CRA. Typically, that's a step up depending on the company. But recruiters will say, you know what, this is the best company. They recruit people in the in-house CRA role to go on to the CRA role. That you'll be in the program within 6 months, blah, 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 blah. They promise you all these things. And then when you finally get to the company and you accept, it's not the case exactly. They may say, yeah, you're able to move after 6 months into the CRA role, but you find out, they hand select the candidates. They only accept a few into the program. So you got to keep trying again and again in another 6 months. They have all these rules and stipulations. Sometimes it's a year after you've applied the first time. Maybe you got to wait another 6 to 8 months before you can apply again, even if they have cohorts moving up and stuff. Maybe you need line manager approval before you can apply. So there's all these things you got to be careful of, making sure you just take a position because you hope that it can get you faster to the next position. So you got to be careful. You got to make sure you do your due diligence there. Make sure that you talk to people at that company. Make sure you talk to the hiring manager. Make sure you talk to anybody in your network that works at that company so you can double check what recruiters are saying. Because I have been in situations where they do play these games to try and get you to get into the company, and so they can close out that requisition until they can get paid. So you got to keep that in mind. That I think that's one of the reasons why recruiters try sometimes to keep you in your own lane, because obviously if you have that same type of experience level, they are going to be able to close that requisition faster because the client is going to be more interested in somebody who already has experience. So it is what it is, guys. That's just how the game is, but you've got to be wary of it. So hopefully this video allowed you to have some insight into how recruiters do things and why sometimes you may get hit up for positions that you don't really want because you want to make that next level, but it's the same level for you and not really interested. So comment down below, guys, if you've had this happen to you, or shoot us an email, eliteclinicalgroup@gmail.com, for any inquiries you may have. All right, guys, take care.